Now, health ministers from G20 countries are meeting in Polokwane ahead of the G20 Leaders Summit later this month, and they will discuss ways to collaborate in order to improve health services. SABC News reporter Katlego Nyoni on that story for us. Let's cross to him for the latest update. Katlego, good morning. And this, of course, very, very important given what we experienced during the last global pandemic with COVID-19. I would imagine that those sort of issues and what's to be expected going forward, vaccine apartheid and those sort of matters are things that absolutely have to be discussed.
Certainly very important there, Sakina. Well, technically today is the official start of the program into the health ministers meeting, as well as the health working group in Polokwane, of course, ahead of the main leaders summit on the 22nd as well as the 23rd of November in Johannesburg. Now, global leaders will rally around harnessing the global leadership into health accountability as well as equity. The ministerial roundtable breakfast, of course, chaired by the former New Zealand Prime Minister, that is Helen Clark, has just started. It will focus on maternal health as well as newborn health and child health. Earlier on, I spoke to South Africa's Health Minister Aaron Motsoaledi, who mentioned that this is a big challenge globally in terms of looking at the health of women as well as children. Of course, Sakina, one of the key agenda points that is going to emanate from this health ministers meeting are discussions into universal health coverage. As we know, the globe in itself is at different levels. Some countries like the United Kingdom and Australia have successfully implemented that. The health minister telling me that in South Africa, our national health insurance is currently still facing several challenges as it has been taken to court by various private sector medical aid schemes as well as private hospitals as well as Solidarity. Motsoaledi then mentioning that 72% of the white population is covered by medical aid, whereas 10% there of the black population still remains is covered. However, a large population still requires universal coverage to health. So those are some of the issues that will be coming out of the meetings here today, as well as, of course, South Africa is home to the world's largest HIV/AIDS program, the Lenacapavir, which we know will be administered and rolled out in 2026, as well as the administration of some TB novel vaccines, Sakina. So those are some of the issues that we anticipate to come out of the health ministers meeting taking place today as well as tomorrow in Polokwane.